Heeskamp and Hubner stated that the ability to understand, interact with, and move within one's physical and spatial environment is a fundamental developmental skill that impacts the development of all other learning domains. Without efficient skills in orientation and mobility, an individual's access to and interaction with the world can be limited to an arm's length only. Independent movement offers individuals who have visual impairments a connection to the world. Orientation and mobility is specifically identified as an essential element of the expanded core curriculum for learners with visual impairments. As such, professionals recognize that it should be given the same attention as the subject competencies contained in the general education curriculum. Orientation is the ability to recognize one's position in relation to the environment, whereas mobility is the ability to move around safely and efficiently. Orientation and mobility training teaches people to use their remaining vision and other senses to get around. Canes and optical aids may also be used. The development of orientation and mobility skills for persons with visual impairments has been associated with several benefits, including academic performance, access to employment, increased integration to the community, and access to social networks. Conversely, the lack of O&M skills has been reported to be related to the underemployment and unemployment of individuals with visual impairments. Vision are often overlooked with and are thought to require less intense and less frequent distinct instruction related to the disability specific needs than children who are blind. The literature within the field of visual impairment often focuses on the needs and developmental levels of children who are blind, with the exception of research related to literacy and access to the environment. Information specifically related to the status of children with low vision and their educational needs is grossly underreported. Although instructional resources and literature exist related to the involvement of children with visual impairments in orientation and mobility, little research is available on the level of orientation and mobility skills demonstrated by children with visual impairments or the specific O&M training needs of children with low vision. Children with low vision do not develop independent skills on their own because they do not observe them in others. They are often not explicitly taught. Although the amount and type of vision varies greatly among individuals, a common requirement is instruction in using what vision they have efficiently. Studies have explored the relationship between O&M and visual abilities, indicating that contrast sensitivity and visual field influence O&M ability and walking speed to a greater extent than visual acuity. Additionally, the direct impact of low vision on O&M has been reported. For the sighted traveler, information for use in avoiding potential obstacles and remaining oriented is subconsciously collected in advance through the central and peripheral visual fields. For individuals with low vision, the information typically available through visual preview of physical surroundings can be absent or unreliable, thus requiring additional efforts to acquire information related to near and distant environments. Mobility issues specific to individuals with low visions were explored when asked to identify mobility difficulties as part of a national survey. O&M specialists and individuals with low vision agreed that the most difficult mobility situations for individuals with low vision include drop-offs, lighting conditions, street crossings, changes in terrain, and avoidance of obstacles. The most commonly identified mobility issue among the 156 participants was difficulty with drop-offs, which included navigating steps, curbs, and ramps. In addition, individuals with low vision reported using a long cane for mobility, and the results suggested that long cane is a useful tool for detecting drop-offs. Participants agreed that variations and fluctuations in lighting created difficulty in mobility for individuals with low vision, thus necessitating instruction in strategies and devices to alleviate its effects. Other difficulties specific to the individual with low vision included inability to distinguish traffic light colors and changes in terrain, including uneven surfaces of sidewalks and streets. Additionally, the study identified that contact with low-lying and head-high obstacles as a problem area. A person with low vision for his mobility not only gets smell, tactile information but also visual cues which are often incomplete or blurred. Clinical and functional assessment is needed before developing an orientation program to a low vision individual. Not all the persons with low vision needed orientation and mobility training, but those who are unable to move with ease, independent mobility is achieved by gradually exposing them to increasingly complex situations. The most commonly reported problems are changes in light levels, night travel, depth perception, glare, recognizing faces and objects, unfamiliar areas, poor contrast, crowded situations, visually complex environments, example market area, railway station, like that. The mobility assessment is the first step designing a mobility program. Instruction may be brief or extended over a period of months depending on age, goals and abilities. First, the mobility instructor or special educator can conduct an interview to uncover problems in mobility related to eye condition and psychological difficulties. A functional assessment is very important, which is to be conducted indoor and outdoor under actual travel conditions. The functional assessment is to evaluate the child's use of visual information and ability to draw on previous experiences. The functional assessment includes identification and avoidance of obstacles, estimation of distances, negotiation of steps, curbs and uneven surfaces, ability to explore from one point to another, lighting needs and adjustment to variable light conditions, discrimination of contrasts, scanning skills, use of aids, use of inputs in other senses, ease and speed of travel. Instruction for a mobility low vision assessment. Choose a route the person is not too familiar with. Use sighted guide at first if the person is unsure to move around unaided. Make sure that holes and obstacles are not avoided while selecting the route. Walking into overhanging branches or falling over stones to watch their visual problems. Observe the person is able to see or not. Ask questions like, what do you see when looking left? Avoid questions that are answered with yes or no. The persons, especially children with low vision, should be familiar with concepts such as positioning directions, size and shapes. For example, positions left or right, front, close, sideways, etc. Directions forward, top, down, like that. Sizes small, wide, thin, high. Shape round, triangle, semicircle, like that. The route should preferably include a short walk. When facing the sun, many persons will be functionally blind. When walking under the shade of a tree, not changes to pace or time of light adaptation. Curbs or steps, holes or obstacles, a path with shoreline like grass or a ditch, small objects with and without good contrast, large objects, lamp post, electricity pole or bus stop pole, different surfaces. The instructor or special teacher should observe the reactions and decisions of the low vision person and ask questions about a brief description about traveling at night. What does he see or what he does not see? Different surfaces, colors seen and at what distance objects can be seen. Ask the person to look at something near to him and then ask him to look at the distant object. Observe his eyes whether shifts easily or taking time, how long distance he can shift his gaze. Is he scanning systematically or at random? Train such person to scan systematically. For example, in an organized way of viewing which depends on the size and distance of the object viewing. Train those who only peripheral vision to view eccentrically. The adult does not have to be taught to see because spatial concepts are usually intact, visual memory and previous experiences are stored. A typical program for an adult includes training in efficient use of vision and hearing, travel skills in the neighborhood and using public transportation, sighted guide technique, the use of long cane and use of visual aids. Children, particularly those whose visual impairment is congenitally or of early onset, need intensive training. A typical program for a child or young person includes visual stimulation, body image, concept development, body movement, sensory training of non-visual senses, independent travel in the known environment, use of visual aids, for example, use of hand magnifiers to read maps, addresses, telephone numbers, like that, and use of mobility techniques such cane travel and sighted cane. Some low vision persons may have to use non-visual technique to supplement vision under some conditions such as night, unfamiliar place or uneven terrain, like that. Some of non-visual aids and techniques are a sighted guide technique allows the low vision person to travel comfortably with a companion. Person with peripheral view loss appreciate a sighted guide in poor lighting and new situation. Older people are often more comfortable with sighted guide. The long cane traditionally associated with blindness can be used by persons with low vision. A person with night blindness who is able to get about easily during the day needs a cane in dim light or at night. A person with limited visual field may more freely using residual vision for general orientation and a cane for obstacle and curb detection. But most people do not realize that the long cane is a wonderful tool that is available to those who have some remaining vision and are not totally blind. If a traveler has some sight but does not always trust his or her vision, a long cane can help by detecting obstacles or elevation changes. The long white cane will also alert others to the fact that the traveler does not see well. The protective arm technique is used to avoid injury to the upper and lower body. This technique can be used if the person's acuity is insufficient for the occasional situation when no sighted guide or cane is available. In the upper body protective technique, the forearm will act as a bumper to protect the head and the upper part of the body from hanging plants, open cupboard doors and room doors that are partially open. This technique can also be used when bending down to pick up objects or when checking a chair seat before sitting down. Even if the person has some usable vision and think he or she is safe, the person should avoid taking the risk to bend over without using this safety technique. The lower body protective technique will protect the body below the waist. For maximum protection, the visually impaired person can use a combination of upper and lower body protective technique. Raise your stronger arm to the shoulder height and extend it out in front of your body as if you were pointing straight ahead. Bend your arm so that your forearm is across your chest and touch your opposite shoulder with your fingertips. Move your hand approximately 10 to 12 inches away from your shoulder. You can estimate this distance by visualizing the shoe box or ruler placed lengthwise between your shoulder and your hand. Curl your fingers, spread them slightly apart and keep your wrist straight as you turn your palm outward so that it faces away from your body. Keep your elbow chest height while you raise the forearm diagonally across the body until your hand is about 10 inches in front of your face. Turn your palm outward with your finger pointing at a slight angle back toward your face to protect them from injury and allow the forearm to serve as a buffer. Trailing is following a wall or other surfaces with the back of the hand. trailing allows a person to remain in contact with physical guidelines to avoid becoming disoriented. The trailing technique can help the low vision person locate a door, walk in a straight line, or detect the position of objects in front. This technique can provide with useful information about everyday objects, obstacles, and potential hazards that the low vision persons may encounter as they move about their home. It can also provide with a feeling of security while walking by allowing the person to remain in contact with walls, countertops, desks, tables, or other types of stationary surfaces. Begin along a straight stretch of wall in an uncluttered area. Stand with the side of your body about 6 inches from the wall. Extend your hand in front of you and approximately hip level and angle downward toward the floor about 12 inches from your body. The back of your hand should be in the contact with the wall with your fingers slightly cupped toward your palm. This will prevent you from injuring your fingers if they make contact with an object. Your fingers will also act as bumpers to warn you about objects that you may encounter. Walk forward slowly while holding your arm in this position, keeping the backs of your fingers, especially the knuckles of your ring and pinky fingers, in contact with the wall. Make sure that the back of your hand is always in contact with the surface while you are moving. The first one is illumination. The amount, direction, and changes in lighting conditions are crucial for optimal visual functioning. Wearing obstructive sunglasses which block ultraviolet and infrared light rays significantly increases functional acuity. Wearing wide brim hats or visors or even using umbrella in the sun help to increase functional acuity and protect one's eyes from glare. When trying to discern an object, person or sign, position oneself so that the sun comes from behind the person. Change angles of viewing to facilitate best position. In dimly lit situations such as some rooms, restaurants and cinemas, use a portable light source such as a pen light or flashlight for spot checking. Appropriate sighted guide or cane techniques are also recommended in these situations where a person is rendered functionally blind. Depth perception. Judgment of presence of drop-offs such as curbs, steps and uneven terrain is affected not only by the person's reduced acuity or fields, but by changes in lighting and contrast. A cane is particularly helpful in these situations as it indicates the presence of up and down steps, curves or uneven terrain. A broken shadow in one's line of path may be inactive of stairs. For example, the shadow of pole on a flight of stairs will appear as uneven and broken, not as a straight line. A cane can be helpful. If vision is always directed downward for safety purposes, using a cane allows freedom to visually scan more effectively and cover a wider path. Following the shoulder line of a person with distinctly contrasting or vivid color clothes provides movement clues to avoid possible objects. Learning to visually scan is a systematic search pattern as opposed to random, inefficient use of visual skills for visual cues in the environment. Conventional spectacles is first prescribed by the eye care specialist to provide the best possible baseline visual acuity. The visual aids that modify light, increase contrast or reduce glare includes visors, wide-brimmed hats, sunglasses, frames with side shields and telescopes. For persons who are night blind or bright light source from flash or torch light may be enable them person to travel without cane. Monocular telescopes or head-mounted bioptic telescopes may be enable the low vision person to localize, focus and track. A person with peripheral field loss can see the effect of magnification by reversing a low power monocular telescope. Magnifiers are specially designed to reduce the image size horizontally, which expands only the lateral periphery of the field of vision. A Fresnel prism is a series of prisms comprised into a flat plastic membrane. These are accurately placed on a pair of glasses in the area of non-functional field of view. Do not interfere with the person's regular vision. The person who is using this, however, with a quick movement into a prism can see objects at the side without any head movement. The prism deflects light rays and causes those objects at one side to appear in front of the person for easy viewing. This visual mobility aid is useful for those with severe constricted visual field caused by retinitis pigmentosa, advanced glaucoma and less severe cases. Persons with low vision often limit their activities because they are afraid of falling, getting hurt and they are not confident in their abilities to get around. Persons with vision loss often are afraid of falling because they have difficulty seeing obstacles like bumps in pavement, curb, cuts, steps, signs and much more. This makes going out in an unfamiliar area very frightening. Commonly, if a person does go out into a community, they have assistance from another person. Needing assistance from others all the time can make them feel like a burden for others. If a person with low vision does not have the mobility skills they need, they will decrease their participation in activities in their communities. This leads to individuals who are socially isolated and depressed. For these reasons, it is important to continue participating in activities in the home and in the community. Persons with low vision learn mobility skills, find and access transportation services, and navigate their home and community environment safely. This increases the person's confidence in their ability to travel in the community and decreases their fear of falling. With this increase in confidence and skills, persons with low vision can participate in activities in their homes and communities that are meaningful to them. Being able to continue participating in meaningful activities helps reduce social isolation and depression and leads to an overall better quality of life.